After 60, here's a number that should stop you in your tracks. After age 30, most adults lose between 3 and 8% of their muscle mass every decade, and by the time you reach your 60s, the loss becomes impossible to ignore, especially in your glutes, the largest and most powerful muscle group in your body, the muscles responsible for keeping you upright, steady, and independent. Yet almost no one talks about them. Instead, people focus on walking, stretching, or supplements, while the real foundation quietly weakens. And here's what makes this dangerous. Your glutes don't just shape your body, they protect your balance, your spine, and your ability to move safely. So when they fade, everything else begins compensating. Your back tightens, your knees ache, your steps shorten, and suddenly simple activities like climbing stairs or standing from a chair feel heavier than they should. And most Americans assume this is just aging, but it isn't. It's muscle shutdown. And if you ignore it, energy shrinks, confidence shrinks, independence shrinks. But the moment you start rebuilding blood flow and strength to your hips, your body starts negotiating its future again. Why walking is not saving your glutes. Walking is the exercise everyone recommends for older adults. And yes, walking is good for circulation and mental health. But here's the uncomfortable truth. Most doctors never explain. Normal walking barely activates your glute muscles, only a small fraction of their capacity, while targeted exercises can activate nearly all of those same fibers. And that difference matters, because weak glutes are not just about appearance. Seniors with weak hip muscles are far more likely to fall. And falls don't just mean bruises at this age. They mean fractures, surgeries, rehab, and loss of independence. Glute weakness is also strongly linked to chronic lower back pain, knee problems, and poor balance that turns everyday movement into a risk assessment. And now here's the surprising part. You don't need squats. You don't need lunges. You don't even need to stand. Some of the most effective glute strengthening exercises for people over 60 can be done sitting in a chair, which changes everything for anyone dealing with joint pain, balance issues, or fear of falling. You don't need to stand to get strong. Researchers discovered that certain seated movements can activate your glutes at levels similar to standing exercises. And physical therapists have used these techniques for decades, especially with patients recovering from hip surgery. And clinical trials show that the right seated exercise can increase glute strength dramatically in just a couple of months. Yet most people have never heard of it. So in this video, we're going to walk through the most effective sitting exercises for rebuilding your glutes after 60, ranked from helpful to absolutely essential. And we'll start with number 6 and work our way up to the one exercise that delivers the biggest results. Because once you understand why it works so well, you'll want to start doing it today. Number 6, seated marching. Coming in at number 6 is seated marching, and it looks simple, but don't let that fool you. This movement wakes up your hip flexors and gently reintroduces your glutes to meaningful work. Think of it as laying the groundwork for everything that follows. Sitting tall in a sturdy chair with your feet flat on the floor, you lift one knee toward your chest, pause briefly, then lower slowly before switching sides. And that slow lowering phase is where muscle building begins, because your glutes must control the movement eccentrically, improving coordination and mobility at the same time. Consistent practice leads to noticeable improvements in hip movement and lower body control, which matter because mobility and coordination are the building blocks that allow your glutes to function properly later. Aim for controlled repetitions on each side, and as strength improves, you can add light ankle weights. But remember, consistency beats intensity, especially after 60. Number 5, seated leg extensions with glute squeeze. At number 5 is a movement most people think is only for the thighs, seated leg extensions. But when you add a deliberate glute squeeze at the top, everything changes, extending one leg forward while actively tightening the glute on that same side creates co-contraction, meaning multiple muscle groups stabilize the joint together, which is critical for preventing falls. Holding that squeeze for a few seconds before lowering slowly trains your hips and knees to work as a unit. And for many older adults, this is where they first start feeling their glutes again. Placing a hand on the muscle can help reinforce that mind-body connection, and research shows that consciously focusing on the working muscle significantly increases activation, turning a basic movement into a powerful rebuilding tool. Number 4. Seated hip abduction. Number 4 targets the gluteus medius, the side hip muscle that keeps your pelvis level when you walk. And when this muscle is weak, your hips drop with every step, creating instability that dramatically increases fall risk. Seated hip abduction fixes this by having you press your knees outward against resistance, either with your hands or a band, creating intense activation without standing. Holding each contraction for several seconds strengthens the muscles responsible for lateral stability, and within weeks many people notice better balance and smoother walking because their hips finally have support again. Number 3. Seated glute squeezes. Number 3 may be the most underestimated exercise on the list, seated glute squeezes, and they matter because many older adults suffer from what physiologists call glute amnesia. After years of sitting, the brain simply forgets how to properly fire the glutes. Squeezing both muscles hard for several seconds while seated helps rewire those neural pathways, and doing short sets multiple times throughout the day works better than one long session. Over time, your glutes begin activating automatically when you stand or climb stairs, and that automatic engagement is exactly what you're after because it means your body is protecting you again without conscious effort. Number 2. Seated single leg glute press. At number 2, we address a problem most people don't realize they have: imbalance. Nearly everyone has one glute stronger than the other, and that imbalance places uneven stress on the spine and hips. The seated single-leg glute press isolates each side by having you press through one foot while lifting your hips slightly off the chair, forcing the working glute to carry the load alone. Holding briefly before lowering reveals weaknesses and builds symmetry. And over time, correcting these imbalances often leads to dramatic improvements in lower back comfort and overall balance. Number 1. The seated glute bridge. Now we reach the number 1 exercise, the seated glute bridge, considered the gold standard for glute rehabilitation. Originally developed for post-surgical patients, but now proven just as effective for healthy adults. Sitting near the edge of a sturdy chair, feet planted, you press through your heels and squeeze your glutes to lift your hips until your body forms a straight line, pausing at the top before lowering slowly. This movement loads your glutes with your own body weight while eliminating balance concerns, creating powerful activation that rivals much harder standing exercises. And studies show seated bridges outperform traditional standing movements in building glute strength over time. Performing a few sets several times per week is enough to create meaningful change, and as you grow stronger, you can extend the hold, add resistance, or try single-leg variations for even greater results. Strong glutes mean a stronger future. There you have it. 6 seated exercises that can rebuild weak glutes after 60 without ever leaving your chair. And the message underneath all of this is simple. Weakness is not an inevitable part of aging. Disuse is, and disuse can be reversed. Your glutes affect your walking, your posture, your balance, and your freedom to live independently. The seniors in these studies weren't athletes. They were regular people who simply showed up and stayed consistent. So start with seated marching, progress through the list, and make the seated glute bridge your priority, because strength returns slowly, quietly, one repetition at a time. And the beautiful part is this: independence doesn't disappear suddenly. It fades gradually, which means it can return the same way, one small choice at a time. And that's where your next chapter begins.